So what do you make of this decision to allow Johnny Hinckley now to essentially be free?
Well, it's very surprising, and given
Is it surprising?
it is surprising to me because given his very extensive psychological history, and in particularly this very long period of time where he was actively psychotic and he was nursing this huge delusion that he maybe had a relationship with Jodie Foster and kind of really over-identified with a movie character, to the point where he shot 4 men, you know, in an attempt to assassinate Reagan. I'm surprised only because he is only free of severe mental illness, is basically what the doctors have been saying, but that's because he's been under 24/7 supervision. So I'm actually a little afraid that they're actually going to let him out into the community so easily. I feel like there should be more of a step-down process, and I don't know if I've seen that here, and I don't even know if we have results of how that's been going when he goes away for a couple of hours at a time.
The guy's now 61 years old.
He was
how much
25 at the time.
danger would he be now? You know,
Yeah.
is it okay for to let him be?
And here's part of the problem. I believe one of his diagnoses was schizophrenia. Schizophrenia is a lifelong illness. If you're on medication constantly, you can monitor it, you can live an active life, and that's wonderful. But when he was still residing in the hospital, even if he was going out on day visits, his medications are administered by hospital staff. Now that he's out on his own, who will make sure he's taking the medication? And oftentimes there are delusions that these individuals will have where it tells them, don't take the medication, it's dangerous for you. And so if he starts to have these thoughts, these are some of my concerns about what can we do to protect him more in the outside environment.
Well, another diagnosis that I saw was that psychosis.
Exactly. That's related to the schizophrenia. It's a very common symptom associated with schizophrenia, and that's what I'm afraid of, is if he starts to have those thoughts, he's not going to tell himself to take medication.
But can I disagree briefly, because reasonable judge and reasonable doctors to say, we're not doing him any good holding him, and he's not a danger to society.
So
how well does he have to be?
So my suggestion, I think, is to add one more limitation. I know that they've already built upon things like going to therapy weekly, things like that.
There are 36 conditions.
I think one condition that they've left out, though, is that he should go somewhere for the provision of medication, just like individuals who go to methadone
To
clinic.
administer it.
Yes, so that we know that he's on medication. I think that that should go on for hopefully a couple of years before we know for sure that he can be maintained in that way.
Oh.